Welcome back. Well, we have a returning guest here today, Dr. Neil Goldstein, and he is with Pettis Orange County. And as we were talking right before we got on, that of course is Latin for feet, and that's where that comes from. But what you're here talking about certainly affects the feet, is a peripheral arterial disease, and it might go under other names like varicose veins and venous disease and all kinds of different things. But let's talk about this. What is it exactly?
Well, peripheral arterial disease actually doesn't pertain to veins, but specifically the arteries. What it is essentially a buildup of the fatty deposits that get calcified. We call them plaque. It builds up on the inner linings of your blood vessels, and it reduces blood flow out to your extremities. Very similar to coronary artery disease, or CAD. It's very prevalent, actually, in the community. Probably about 10 to 12 million people in the United States are affected by it currently. Upwards of 20% of patients over 65. So it's very, very common, and it's very debilitating.
What causes this? Are there certain diseases? People, I would think, with diabetes might be more prone to this. Or are there medications or something?
Yeah, definitely. It's associated with certain conditions like diabetes, and smoking is probably one of the things that are linked to it most closely. Having a poor diet that's high in fat, lack of exercise, high blood pressure, high cholesterol. Many of those lifestyle conditions, which are preventable, are linked to peripheral arterial disease.
Any hereditary in it? Is there anything like that? Or
I think there's certainly a predisposition for it. If you have a family member that succumbed to a heart attack very early in life, like in their 40s or 50s, there's probably a very high predisposition for developing arterial disease in yourself as well.
What are the initial symptoms where somebody might look at it and go beyond, okay, this is just a little something or other, versus, okay, it could be serious?
So interestingly, the early symptoms are mild, and people tend to ignore them for quite a long time. The first symptoms that you may experience would be cramping in your calf muscles or thigh muscles when you're walking, which would limit your tolerance and your endurance for walking long distances. And a lot of people just scale back their lifestyle when that happens and consider it to be normal aging. And eventually it reaches a milestone for them where, say, they can't make it down the block anymore. They can't get from the car to the shopping mall or keep up with other family members. And then all of a sudden they realize this is too much, and they come to medical attention. But at that point, they've already got very advanced peripheral arterial disease. The blockages in their arteries would probably reduce the blood flow to their feet by 50% or more.
Wow.
And from there, it only gets worse.
So now, on your website here that I'm looking at, pettisorangecounty.com, some of the photos here, a lot of redness, which it looks very much like bruising and things like that. Are they going to see that at first?
You may be looking at the venous disease pictures.
Oh, okay. I'm looking at. I'm looking at the pictures at the top.
The pattern for arterial disease, it does follow patterns, but it's different and distinct from the venous patterns. So with arterial disease, there's less blood flow. So you wouldn't see swelling. You wouldn't see redness necessarily. You might see paleness. You might see loss of hair, coldness, numbness. The nerves need oxygen to work as well. And if you developed an infection, which many patients develop without even knowing that they have it, then you could see signs of redness or inflammation. But a lot of times, because of the neuropathy and lack of sensation, you may develop breaks in the skin that can become infected. And without an adequate blood supply, your immune system can't get down there to fight off the bacteria, and you can get really serious infections when you have peripheral arterial disease, particularly with diabetics who have a compromised immune system to begin with. A lot of these patients come to the attention of podiatrists first because they have a problem with their foot, so they go to the foot doctor. So we've worked very closely with a very dedicated team of podiatrists that know that, unless we revascularize the patients, that any of their treatments for the patient's wounds just aren't going to be effective.
And we've got about a minute left, and I'd like to hear about quickly the treatments that are available. Is this treatable, and can it be reversed?
Definitely treatable. The most important thing would be, if you have peripheral arterial disease, you must modify your lifestyle. Quit smoking, control your diabetes and your blood pressure, eat a healthy diet, low in fat, get exercise. Those are the most important things for even any interventions that are done to ensure that you get a good long-term outcome. Fortunately, nowadays we have very sophisticated catheter-based, minimally invasive procedures that can really help with peripheral arterial disease. What we do mostly in our clinic is atherectomy, which is a series of devices that we have that can remove the plaque. debulk the plaque, restore normal elasticity to the blood vessels. Beyond that, we can use balloons and stents to stretch open and hold open blood vessels to get better blood flow for longer term. And those are very highly successful. Technically, they're successful, and they have a very good long-term success rate, which is as effective as bypass surgery used to be. So.
All right, very good. Well, Dr. Neil Goldstein is with Pettis Orange County, and website pettisorangecounty.com, as you can see there. You can get some information, and you can see how serious this could be if you got to get on it early for sure. Thank you very much for coming on. It's been a pleasure. All right, we'll be back in just a moment.